If you see smoke from a mile away and the fire department showed up to address the smoke, if you just filter it and fan it and blow it, what happens to the fire? It rages. You gave it more of an opening. And in a lot of ways, that's what we do with our approach to patients. We say that in acid reflux, the acid is the problem. So what do? We use medicines that cripple our acid pumps. Not many people are really asking, like, well, why is the acid there in the first place? And so the symptom that brings people to seek care is actually usually the least of their worries.
The challenge that I think our country is having and parents are having is that they are treating the effects and not looking at the causes. I mean, it's not enough to just have our kids just be great for an hour or two in a classroom because we're medicating them. What is the effect of that their entire life? If they become addicted or if their body becomes dependent in some way, shape, or form. Young spines are degenerating, and we are masking the symptoms with drugs. We are masking the symptoms with medications. What does that mean for that child? What does that mean for an adult who just masks the symptoms, the pains, the discomfort with medications? It means that the habits, the actions, the lifestyle that person is living, which is being covered up, is causing increased decay in the areas that are decaying. It speeds the deterioration. It's time we listen to our bodies and get to the underlying cause.
In medicine, we're always taught, okay, you have this pain or you have this fever, just use this medication. But you have to ask yourself, why is the body so inflamed? Why are they going through all this extra stress? Or why are they having this pain attack or this excessive migraine or whatever? Maybe it's a stress. Maybe it's something that could have happened, or they could have had a stress or some type of emotional event in their life in the last 2 or 3 weeks. And you have to, when you treat an individual or treat families, you have to look at a whole body approach.
The spine can become misaligned. It can stop moving appropriately. And when it does that, it creates an interference in the nervous system. And that may be a day-old baby, it may be a 15-year-old person out of a car accident, it may be just a person that's under stress for 20, 30, 40 years, maybe someone that works at a job that looks at their phone every day. These stress accumulates, and then unfortunately, they end up getting a symptom, and they go to the trusted person in their community that they've been taught is where the health comes from, and that is usually a medical doctor. And then that starts that cascade of a diagnosis, a prescription, another diagnosis, and so on. And so what we're saying is, if you understood from the get-go that your spine has stress, and the more stress it accumulates, it can create a problem, not just with the spine, but with all aspects of health because of that interrelationship with the brain.